Welcome to our next installment of our YouTube videos. Today we are going to be discussing the differences between a traditional open spay and also a keyhole approach, a lap spay. So, over the past sort of 12-15 years, there's been an approach of the keyhole surgery for lap spays. Before that, what we've always been trained to do is the traditional open spay method, whereby a long incision is made along the abdomen and from which we will exteriorize the ovaries and remove them together with the uterus. It's what we call ovariohisterectomy, or OVH for short. As I mentioned, in the last sort of 12-15 years, there's this particular method of keyhole surgery, which has been used for many years, much before that in human surgery, and finally it's sort of transposed to vet medicine to utilize the benefits of it, as we have found. So the biggest difference between the two sort of approaches is that the Lap spay, or the keyhole surgery as what it suggests, is called minimally invasive surgery. It does not require a large open wound. Instead, it can have two little wounds or two little surgical sites, no more than sort of half a centimeter to one centimeter wide, and that is where we sort of can visualize where the ovaries is, removing the ovaries by coagulating and cutting it neatly out rather than any sort of excessive force in tugging, pulling, breaking ligaments, which is usually associated with more pain involved when we use in a traditionally open surgery. So with that in mind as well, reports have said that the anaesthetic depth, or rather the use of anesthesia, is much less in a minimally invasive surgery like lap spays and keyhole approaches, rather than the open traditional spay. So that is why we sort of favor the lap spays a bit better. Other sort of advantages of it is that because it is using a camera, and also it is magnified, and also because we use a much brighter illumination, we can actually see the organs much more clearly for us to be able to do what we need to do, compared to having a direct visualization of a ovary that you have exteriorized from the abdomen in the traditional open spay. This allows the surgeon to work much more efficiently, and is usually what we call a bloodless feel is achieved, because everything is just picked up and carefully cauterized and cut. There usually isn't any bleeding involved in it at all, compared to an open spay where there is breaking, damage to tissues and things like that, which does result in sometimes quite significant bleeding for those particular procedures. Another advantage that we do have, or rather that we've experienced, is that because of all this fine handling of tissues and accurately coagulating and cutting the tissues out, and two little holes rather than one big sort of a surgical site, post-operative pain relief is much better controlled. Most of the time we find that we do not have to give them any extra pain relief at all apart from the day itself, and we have actually tried to give pain relief to the owners before, but we find that most owners bring them back on day 2 to say that it is not needed for the post-op checks. It's not needed because 98% of them report the next day as though nothing has happened. It's that sort of a quick recovery, and most of them actually have got problems trying to keep them still rather than trying to manage the pain relief side of things. So these are the reasons why we feel that lap spays are a little bit nicer or better than traditionally open space, because for the surgeon it is a much straightforward procedure, because like I said, everything is magnified, there is better illumination, there is no trickiness, technical difficulty in trying to break a ligament, hoping not to spill any blood or break any tissues or things like that. For the animals, they tend to have a lower dose of anaesthetic, so the recovery is much better. they tend to be a bit more pain-free during the surgery itself, and also post-surgery itself, because they recover much faster. And for the owners, they tend to enjoy this, or rather not enjoy, but they tend to prefer this method, such that 100% of owners would recommend this method again if needed, because of the painless state or the quick recovery that they see their own pet experience. And that is our sort of experience with the owners, to say that yeah, they definitely, it's a no-brainer, they'll definitely go for this. And for these few reasons, that is why we sort of prefer a lap spay over a traditionally open surgery. I hope this has been useful for you, and certainly it has been out there on the market, but you know, the understanding of it is still quite little. So I hope this video has helped for you to see why we prefer lap space over open space, traditional open space, or more importantly, the differences between the two of them. If you have any comments, please do comment below. If not, I wish you a very nice day, and we'll see you in the next video. Thank you.